sights and sounds of Jamaica, a tropical oasis that made it an enticing travel destination for Mr. and Mrs. Hill. But when the time came for the young couple to pack their bags and return home to Boston, their dream vacation quickly turned into a medical emergency.
And the very last day when we were getting ready to head out to catch the bus to come home, Stephen came out of the bathroom grabbing his right arm saying, "I think I'm having a heart attack," and he dropped to the floor and had a seizure.
Soon, an ambulance arrived to take 33-year-old Stephen Hill to a local Jamaican medical center.
And they brought us to Montego Bay to a private facility where they did a CAT scan and realized he had had a massive left-sided bleed in his brain, and we had to be air ambulance back to the States ASAP. We ended up here, and it happened to be the best thing that ever could have happened to us.
Neurosurgeon Dr. Santiago Figueiredo was working at Aventura Hospital that fateful day. He received word of Stephen Hill's critical condition.
Well, at the time he arrived, he was comatose. He was not really responding or doing much. He was having bleeds into his brain, and the concern was why a young person having so many bleeds.
The condition that contributed to Stephen's stroke is a genetic blood disorder called protein C deficiency. It affects 1 out of every 200 people in the United States and is known to cause clotting.
And we found indeed that he was having blockage of those veins with increased pressure in the arteries and basically a pipe burst causing the bleeds in the brain. So it became urgent at that time to go ahead and try to unblock those veins, and the whole treatment procedure followed that path.
The first procedure brought Stephen emergently to Aventura Hospital's cardiac cath lab.
We asked Dr. Osterman, our interventional neuroradiologist, to try to perform a procedure where through an angiocatheter with minimal invasive approaches, get into those veins and try to dissolve the clots. He did it, and he was successful in about 50–70% of the blockage, but he didn't take care of all the blockages. And his brain continued to swell and bleed some more, so at that point we had to take him emergently to the OR, to the operating room, to perform a life-saving procedure. At that point, the damage on his brain was pretty significant, so we didn't think he had many chances of recovering.
That gutsy call involved a very difficult procedure for the surgeons.
I had to actually open the vein, make a cut on it, which is a very scary procedure. We never do open those veins because it's hard to close them back again. So I went ahead and opened it, and then I used a catheter that has a balloon at the end. So you put the catheter through the vein, you inflate the balloon, and then you pull it back and try to pull the clots out with it. And I kept doing that until I finally felt that blood was flowing through and opening.
It's so good to see you.
Good. How are you doing? Good. Awesome. Looks like.
It's an emotional reunion for the Hill family and members of Aventura Hospital's medical staff. It's been a year since the accident, and while Stephen has no memory of ever being here, he wanted to come back with his family and say a heartfelt thank you.
Very important to be back here today. This is almost like my second family. Aventura Hospital has been extremely special to us. They treated us from the very moment that we stepped in here. They surrounded us with a caring staff, an understanding staff, people that would take time out of their day to give us specialized attention.
He's doing fantastic. He's had the surgery successfully, no problems, and he's now full-time rehabilitation and outpatient therapy. The care and concern and everything that we've had here at Aventura, they made us their family, and those doctors were just absolutely incredible. I honestly feel we were sent here for a reason.
The hospital provides us with the tools that we need to do these procedures. The more we advance the techniques, the more they understand that we're here to do a good job and take good care of the patients, the more they're willing to support us. And they have, over the past year, invested immensely on technologies to develop the neuroscience and the stroke services at Aventura.
We want you to know you'll always be in our heart. So this is for you. Take back and just know you have a little piece of Aventura with you all the time.
The staff of Aventura Hospital held a special brunch in the Hill family's honor. They presented the family with a special heart, signifying their ongoing love and support. Stephen's accident, although tragic, has now taken on a new meaning for the entire family through a foundation they started together.
And we've raised quite a bit of money, and it's now allowing Stephen to get the special equipment and training that he needs, because insurance only goes so far. And promote the fact that, stroke doesn't only happen to the elderly, it happens to, victims of all age, and we see it more and more being in this realm now.
That's why it's important to know the symptoms of a stroke. They can include sudden numbness or weakness of the face, arm, or leg, confusion or trouble speaking, trouble seeing out of one or both eyes, dizziness or loss of balance. Even a severe headache can signal a stroke. If you do experience any of these symptoms, you should call 911 immediately. To learn more about Aventura Hospital and its staff, you can log on to the links listed on the screen. Reporting for Aventura Hospital and Medical Center, I'm Robin Kane with the Healthcare News Network.